what physiotherapy is all about. So, the objectives of this session. One of the things that happens is when I go out, it's an experience I've had, when I go out and I introduce myself as a physiotherapist, a lot of people outside will be like, I'm coming for my massage, my back is paining me, my neck is paining me. And then even in the hospital, a lot of times when I go to the ward, and I'm sure it's something that a lot of us as physiotherapists can relate with. When you go to the ward to see a patient and you see some healthcare professionals and then they tell you, oh, physiotherapist, I'm having back pain, I'm having neck pain. We've had people walk into the department and say, I just feel stressed out, I just want a full body massage. Now, this is not what physiotherapy is all about. There's a lot more that we do. And the reason for this presentation is for us to educate you on what physiotherapy is, to educate you on what we do, the modalities that we use, and also to educate you on the various subspecialties of physiotherapy and then the various cases that we manage, so that when we encounter patients that will require our services, you can easily refer them to us and then you have a better understanding of what we do. Why do patients come to the hospital? It's a question I want us to think about. A lot of times we encounter patients. Why do they come to the hospital? Most times patients come to the hospital first because of pain and then secondly because of dysfunction. Now, pain. A lot of patients, if they feel, if it's pain they can manage on their own, they don't necessarily come to the hospital. But then for a patient to present in the hospital because of pain, then you know that it's a pain that is affecting their quality of life and affecting the activities of daily living. Also because of dysfunction. A lot of people can live with some degree of dysfunction and they don't bother. But then when a patient presents because of a particular dysfunction, then you know that that dysfunction is having an impact on the way they do things, on their activities of daily living. Probably it's affecting their job or things they like to do in their leisure time. Now, physiotherapy addresses both pain and dysfunction. That is the thing we do. We address both pain and dysfunction. We address patients who are in pain and patients who have various degrees of dysfunction, in addition to prevention of reoccurrence. One of the things we do is that we don't want patients to come up with pain. We don't want them to come up with dysfunction. So if they do come up with it, as much as possible, we don't want it to reoccur, because the more it reoccurs, the more it would have an impact on that patient. We also train patients when there are changes that occur, because it's not every condition that a patient comes up with that you can cure 100%, but when there are certain changes, we train them on how to adapt to those changes that they have. One of the things we also do is we're focused on is community reintegration. We are focused on helping the patients not just to feel better, but to be able to go back to their communities and do what they would usually like to do the things that they used to do without difficulty. So it's not just about addressing the pain and dysfunction, but we want them to be able to go back to doing the things that they love to do. We want them to be able to go back to their places of work. We want them to be able to go back and function properly in their families. And overall, improvements of the quality of life of the patients. It is important that patients have a good quality of life. It's not just about living, but patients have to live well. So that's what we do. Now, what is physiotherapy? According to World Physiotherapy, which is a global body that represents physiotherapy worldwide, physiotherapy is providing services to individuals and populations to develop, maintain, and restore maximum function and functional ability throughout the lifespan. We'll be shedding more light on this subsequently as we go on. According to the WHO, the World Health Organization, physiotherapists assess, plan, and implement rehabilitative programs that improve or restore human motor functions, maximize movement ability, relieve pain syndromes, and treat or prevent physical challenges associated with injuries, diseases, and other impairments. Physiotherapists are autonomous and independent professionals. It means that we are able to make decisions for our patients and carry out management within our scope of practice. Now, physiotherapists are trained, and with advancements now, physiotherapists are trained to be able to, we have courses like the DPT programs, that's the Doctor of Physiotherapy programs, and then the Advanced Physiotherapy Practitioners program, where physiotherapists gain the knowledge, because sometimes patients will present to you, especially with the knowledge of physiotherapy. Some patients are having back pain, they will present to you, and then you'll be able to assess them and know if this patient should be managed by physiotherapists or if they should be referred to another healthcare professional. So this we do within our own scope of practice. Now, physiotherapists also work as part of a multidisciplinary health team. We don't manage patients alone. And as such, we work together with other members of the health team to be able to ensure that our patients get the best care. And one of the ways that patients benefit from this is that when we communicate with other members of the health team effectively, it helps to better the care that patients receive. Scope of physiotherapy practice. Now, physiotherapists work in public health strategies, they work in advocating for health, they also work in supervising and delegating, in leading, managing, teaching, research, development, and implementing health policy at all levels. Now, these are the settings that physiotherapists can work in. They work in community-based rehabilitation programs. You would also find physiotherapists in community settings working there. They work in education and research, hospitals, nursing homes, outpatient clinics, private practice, prisons, schools. In a whole lot of places, you find physiotherapists working there. So our job is not just confined to just the hospital setting, but we are found in all of these places and more. Why physiotherapy? Now, we all know that functional movement is central to what it means to be healthy. For you to be classified as being healthy, then you should be able to move, you should be able to function. So function will be things like walking, doing day-to-day things, running, doing, picking a spoon, carrying objects. All of those are necessary for one to be classified as being healthy. And physiotherapists are movement specialists. That's what we advocate for. We're interested in how our patients move. We're interested in them being able to carry out their day-to-day activities without any difficulty. Physiotherapists see patients from cradle to grave. So we have babies that we see in the hospital. So we have children that they give birth to with different obstetric issues. So we could have cerebral palsy, obstetric brachial plexus injuries. We see those kind of patients. We also see patients who are children and maybe have we have patients that could present with cerebral palsy at a later age. We also have patients that suffer from cerebral malaria. We also manage those kind of patients. And when we go to the youth, we also see patients with sport injuries. The elderly, we see patients with degenerative diseases. Now, movement and function can be threatened by aging, injury, pain, disease disorders and conditions, and environmental factors. And because of this, it is important for us as physiotherapists to come in to try to restore the movement and the function of these patients that we see. Roles of physiotherapy. The first is physiotherapists promote health and well-being. That's one of the core things that we do. We promote the health and the well-being of patients. And that is why, as I said earlier, we are movement specialists. We encourage everybody, even before they come down with a disease, for them to be active, for them to move. Because physical activity has been shown to address a lot of non-communicable diseases. So instead of just waiting for the people to come down with the disease and then you begin to think of treating, we promote health and well-being. We also at the preventive stage. We also help to prevent some of these diseases. So we teach patients how to adopt the right posture, how to do different things in order for us to be able to prevent them from coming down with diseases. We are also there at the treatment and intervention stage, which is when the patient has already come down with disease. We offer treatment and intervention to be able to restore the function of this patient to get them back to doing what they used to do. And then the rehabilitative stage, which is where we hold the hand of the patient and ensure that the patient regains their function fully and is able to go back into doing the things they used to do in their community. We're also there in the preoperative stage and perioperative stage. Now, physiotherapy has been shown to give good outcomes when patients who are about to undergo a surgery are being invited. So I'll give an illustration. Sometimes we have patients who are about to go through a hip or a knee replacement. And usually, most times, people would wait, the managing team would wait and send the referral probably at the end after they have had the procedure. But then for patients that are sent in early and then we commence physiotherapy preoperatively, those patients will usually do better. They would have a better starting as compared to patients that are sent in after the procedure has been after the patient has undergone that procedure. So another thing is for patients that are going to be sent in that are supposed to go for surgery, when they commence physiotherapy before the surgery, it also helps them to have an idea of what physiotherapy involves. That way, when they commence physiotherapy post-operatively, would see that the level of apprehension will be less as compared to if they don't even have an idea of what physiotherapy is. And then after, they are in so much pain, there's edema, and then you tell them, okay, you're about to commence physiotherapy. Most times, those kind of patients are apprehensive towards physiotherapy sessions. Another thing is when patients have preoperative and perioperative physiotherapy, it is shown to reduce the length of hospital stay, so they are discharged earlier as compared to when you wait until after they've had the procedure. At the same time, it helps to take care of other diseases that may come up as a result of their stay in the hospital. Then it also reduces the cost of the patient, because a lot of people are going through tough economic times and they cannot afford to pay for long-term physiotherapy and long-term stay in the hospital. Immediate post-op, physiotherapists also come in to be able to rehabilitate the patient, to get them to be able to go back to function at near optimal level. And then follow up after discharge and outpatient physiotherapy. When we discharge patients, after patients are discharged from the hospital, they still come back to meet us, and then we continue to rehabilitate them until they are at a level that we are comfortable with, and then they can go back to functioning without any difficulty. Now, the physiotherapy approach. The first thing we do is to carry out an in-depth assessment of the patient. So the in-depth assessment of the patient will come up, we'll do the subjective assessment and then the objective assessment of the patient. When we do that, one of the things in the subjective assessment, we get the general history of the patient from the patient's point of view, and then we go to the objective assessment, where we now carry out special tests, check for range of motion, muscle strength, we use outcome measures. All of this would help us to be able to evaluate the findings from this assessment to make a clinical judgment about the patient. After we have done that, then we formulate a functional diagnosis, prognosis, and a treatment plan. Now, in formulating the functional diagnosis, as I said earlier, we are focused on the function of the patient. So a lot of times, most times, the physiotherapy diagnosis may be different from the medical diagnosis. So a lot of times it will be concerned about maybe inability to walk, inability to make functional use of the upper limbs and all of that. After that, we'll provide consultation within our expertise and determine when the patient needs to be referred to another professional. We have times where patients present to us, and then in the course of our assessment, we realize that there are certain red flags or certain masqueraders that could be coming up as though they are cases that physiotherapists can handle, but then there could be red flags, and then we can refer them to the appropriate professional that is supposed to manage them. Then we implement a treatment program and education in agreement with the client. Our treatment programs are usually evidence-based. They are treatments that have been proven by evidence to be effective for our patients. And one of the things that we pride ourselves as physiotherapists is the fact that we spend a lot of time with our patients. Now, in getting to spend a lot of time with our patients, we're also able to educate them on their condition, because a lot of times when you educate patients on their condition, you empower them for them to be able to contribute and then to do their best in order to feel better and to recover. So getting the patients to understand what is wrong with them, what we are doing for them, would help them to be able to give their quota in ensuring that they recover. And in the process, we evaluate and re-evaluate our outcomes of evaluation. In case the patient isn't doing better, we know how to re-evaluate, we plan our treatment, we know, okay, what changes do we make, and all of that in order to ensure that the patient is doing well. We have various interventions that we use as physiotherapists, and this depends on the condition and the patient needs. We don't have a one-size-fits-all. We don't have a rule that every patient that comes in, not every patient will get all of this. But then, some of these are education. One of the things we pride ourselves in is being able to educate our patients. And educating them usually would help to empower these patients in their recovery journey. We also offer therapeutic exercises, which will also depend on the presentation of the patient. There are an array of exercises that we give to patients. We are the exercise specialists. So depending on the presentation of the patient, we'll give them exercises. Then we also offer functional training, not just about strengthening them, but training that will help them to be able to function properly. Then we also have manual therapy techniques that we give to patients. These are just some mobilization techniques that help us to be able to get certain results for our patients, like pain relief and improvements of movement. We also prescribe, apply and fabricate devices and equipment. Then we also have airway clearance techniques that we use for patients that have accumulation of fluid in their lungs, breathing techniques for patients that have breathing difficulty, issues with their respiratory system, integumentary repair and protection techniques that we use for the skin for our patients. We have patients that present with an array of issues with their skin that we can also help. We also have an array of electrotherapeutic modalities that we use for our patients. Some of them are the short-wave diastema, ultrasound. There are lots of them that we use. And then we have various physical agents and mechanical modalities that we also use for our patients.
Now, not many people know that we have specialties in physiotherapy. Everyone assumes that a physiotherapist is just a physiotherapist. I have had several instances. My specialty is neurology, and I've had several instances where a healthcare professional or anybody could just walk into the department and say that they have back pain or neck pain and orthopedic conditions, exactly, and then they would require that I or somebody in my unit would see them. And then when I try to explain to them or try to let them know that I would alert the people in that unit, that's in the orthopedic unit, it seems to be an issue where people think I'm trying to run away from tending to them. So it's not so. Physiotherapists work under different specialties, and these 8 are the ones that have been identified and are acknowledged in the Nigerian context by the Nigerian Postgraduate Physiotherapy College and by the MRTB, which is the Medical Rehabilitation Therapist Board, and Nigerian Society of Physiotherapy. Of course, there are several subspecialties under this, depending on the parts of the world that we're in, but we will concentrate on these ones for the purpose of this presentation. Now, of course, I'll start with neurology, which is my own specialty. And there are the usual culprits we see: stroke, ataxia, facial pulse, which we get multiple referrals for, especially stroke, for example. And I'm quite impressed, I would say, with the neurology department or the neurology unit of this hospital, where stroke patients are referred very early enough that they are referred right from the A&E units, which is essential for their functional prognosis, for them to start physiotherapy from day 1 of having had a stroke and after having been stabilized, right? Now, you would notice that I have 2 there in red. Those are things that I'm yet to see a patient with vestibular dysfunction being referred to physiotherapy. And I've worked in different hospitals before coming here in Kano, so I've never seen a patient with vestibular dysfunction being referred. And it is important to note that persons with vestibular dysfunctions are candidates for physiotherapy, and physiotherapists in the neurorehabilitation specialty are trained to handle this kind of conditions. Now, the second is Parkinson's disease. Usually we get referrals, but we get late referrals, 3 years, 4 years after diagnosis, when the functional symptoms have already started setting in. Now, this may be because they naturally do not present early also, like we say. My colleague has said that in the Nigerian context, even the pain and dysfunction that patients present with is usually the pain and dysfunction that is really disturbing and stop them from carrying out their activities of daily life, right? So it might be due to that, but then also we have had patients who have had Parkinson's disease, were diagnosed 2, 3, 4 years, but then were referred late. So it's important that we have early referrals. And I would like to say that neurorehabilitation works on a lot of concepts, one of the most important of which is neuroplasticity. And neuroplasticity is the ability of the brain to reorganize and regenerate itself functionally, structurally, in response to learning. Essentially, neurorehabilitation therapists, or we say physiotherapists in general, are like teachers. A lot of us who have done our postgraduate programs had to do education courses as well, because you teach. There's no way you can rehabilitate a patient without teaching them, and teaching is a continuous process, right? And by that, it means that the brain and the patients are able to learn, unlearn, and relearn functional capacities or functional abilities. And when we're talking about regaining function, patients who have had neurological issues can recover either the right way, that is after having seen a physiotherapist, or they can recover functionally by compensation. We're all humans, and humans are designed to kind of reorganize themselves. It's like a survival instinct. When you've had an issue, automatically your body tunes in to find ways for you to be able to function, not necessarily the way that you were, but you have to find ways to be able to survive. So the issue is sometimes when we have compensations, it might still be a functional situation, but then the person can function wrongly. And then that can give rise to a lot of things like contractures, deformities, which may give rise to other things like pains and other disabilities that were not there prior to the compensation. So by this, I'm saying, I'm reiterating on the importance of early referrals for all patients that require physiotherapy, because we operate on the principle also of use it or lose it. Whatever function you have, whatever thing you have learned, if you do not practice it well enough, following the principle of repetition, you are able to, or you are liable to lose that function. Right? So the next specialty, well, it's still under the same specialty, neurology and mental health. So numerous researches have shown that exercises tailored to the person's individuality, to the person's condition, to the person's state of mind, to the person's social and psychological status can help relieve things such as stress, can help relieve and manage symptoms of anxiety and depression. Now you'll notice the three that are in blue. Of course, they are not typical mental health issues. They're mostly brain or neurological disorders, but then their presentations sometimes are presentations typical of some mental health issues, which are things that the therapist will help to manage. So these conditions are also cases that therapists can manage, help manage, and patients like this need to be referred to the therapist. Now talking about anxiety and depression, we have a lot of times we encounter patients, back pain, neck pain, and then when you probe, you cannot find any structural issue that is leading to that back pain. And they keep on coming back and forth, we keep on managing, it's like patch and go, and they keep on coming. So when you really probe into, because like my colleague said, we spend a lot of time with our patients, so it gives you an insight into their lives, into their psychological state of mind, into their social aspects, their social cycle, what they do on a daily basis. So you get to know things that may may predispose them to things like anxiety. Like we have had issues, we have had situations where we've had to refer to what do you call it, psychiatry department, because I had this patient with current back pain, but then when I probed, she was having panic attacks, she didn't know what they were. She was, having sweaty hands and all that, and so I had to refer her. And then of course, when you mention psychiatry, patients tune out. So you have to have established a good relationship with them before you start mentioning, okay, it might be a psychological disorder, it might be a mental, because people think, once you say psychiatry or psychology, people think crazy, right? So it is a long process, but then it happens. So that's that about neurology and mental health. So now pediatrics, right? We get referrals for a lot of things also, and especially babies with CP. Now you also notice the two that are in the right. I am yet to see a referral from pediatrics unit for a patient with idiopathic toe walking. Now this is a condition that requires early physiotherapy also, because if it persists beyond 2-3 years of age, the child may present with TA tightness, balance issues, and if there are girls as they grow up, it might be an issue of you're walking this way, somebody's pushing you, right? And then premature babies also. Every premature baby is at risk of having developmental disorders. And as such, every premature baby ideally should be assessed before discharge by a physiotherapist. And the essence of that is for monitoring and continuous evaluation. Just because they have not presented with the functional disability does not mean that we have to wait for it. So if a physiotherapist assesses a premature baby before they even show any signs of developmental delays, there's a higher chance that they are more on track, keeping record of the child's developmental milestones, and then if there were any issues that were to occur during the course of the child's development, the physiotherapist would be in a better state to evaluate and proffer the right treatment or management plan for them. So the next is orthopedics and manual therapy. Now I know everyone is waiting for me to say back pain, neck pain, the usual culprits. So you'll notice it's not even on the list, but I just put that picture there for effect, because it's one of the things we receive the most cases for in the therapy department, be it from lay persons outside or even from healthcare professionals. We have had several instances where we have either nurses or doctors staggering into the department, my back, this and that. So one thing that I also want to highlight is that thoracic outlet syndrome is something that we don't receive referrals for, and it's something that physiotherapy can help manage. Usually whenever we have cases of thoracic outlet syndrome, it's just an incidental finding. The patient was referred, for example, for back pain or for neck pain, and then when we probe, okay, they were diagnosed with thoracic outlet syndrome. So all those on the list, including thoracic outlet syndrome, of course, all these lists are not exhaustive. There are a lot of other conditions that are available by physiotherapy. Now, the specialty of geriatrics. I think I would say the therapy department has a very close relationship with the geriatrics department of this hospital. Kudos to Dr. Osiogu. She's one person who is always, she would walk into the department, like I have this patient, what plans do we have for them? This is what I want with them. So it's really important to understand that they don't have, elderly people do not have to come down with mobilities for them to require physiotherapy. Now, one thing of note is the issue of falls, which is one of the highest leading causes of mobility and even mortality in the elderly, right? And the person, even at a risk of fall, is required to go through physiotherapy to improve their balance. Because the fall risk is not just about just falling and then that's it. They come down with hip fractures. In worst case scenarios, something close by, they could hit their head, and then we have a hemorrhagic situation, and then a downfall, a downslide situation from there on. So fall risks are very important issues to refer geriatric populations for physiotherapy. Of course, we have the usual degenerative diseases, arthritis, spondylosis, and whatnot. And then other geriatric comorbidities like dementia, frailty also, require physiotherapy because exercise has been shown to reduce the impact of frailty in the elderly. So the next specialty is HIV/AIDS oncology, hospice, and palliative care, summarized as the HOPE, it's just called the HOPE specialty. Now this specialty is gaining a lot of awareness recently, mostly because of the upsurge of cases of oncology that we're having. Not so much HIV and AIDS these days because of a lot of activity by NASCAR, where a lot of people with HIV and AIDS are being enlightened, and so we don't have that many chronic cases that require hospice that much. But then a lot of persons under this category or under this specialty will come up with issues like reduced strength, impaired bed mobility, pains, impaired balance, and these are all issues that require physiotherapy as well. So mostly in the western parts of the world, this is the thing, this is the specialty that is really lucrative these days. It's not so much well formed over here. Over here we see more requests for domiciliary services for elderly and for terminally ill patients, which we will discuss in another specialty because it's part of a different specialty also. Now the cardiopulmonary specialty deals with things to do with cardiac and the pulmonary systems, but it's a lot more than just rehabilitation. Okay? It's also about conditioning. Because when we think of patients that are in the hospitals who do not necessarily have cardiac issues or pulmonary issues, they may come down with those conditions or with those issues pending the degree or the duration of their hospitalization. So in that essence, you need conditioning for those patients. And in that regard, I would say that our intensive care units, for which in this hospital we have 3, neonatal ICU, main ICU, and the trauma ICU. But in other places where we have the cardiac care units, the neurological care units, different intensive care units require physiotherapists. And it's a very lucrative specialty also because of the importance of intensive care for patients. Right? And so the rehabilitative cases that we usually see for physiotherapy is cases of myocardial infarction, cases of CABG, or patients who have had COPDs that require some pulmonary rehabilitation. Now, women's health and wellness. Now, we all know anything, like if you want to start an NGO, you want to concentrate on women and children, garner a lot of impact. So women's health is an important aspect of healthcare generally, and physiotherapy has a lot of roles to play in prenatal period, because every woman who is in the reproductive age or who is producing already or is planning to reproduce needs to have a healthy pelvic floor reproductive system, and then exercises and a lot of other things help to achieve that, right? Now at the pregnancy and antenatal stages also there's a lot of importance, or there's a lot of need for some physiotherapy, because some of our teams have started going down to antenatal clinics to offer physiotherapy services, what is safe, what is not safe regarding physiotherapy and exercise. Now after a cesarean birth also, it's important to indulge the services of a physiotherapist. Now when we go to things like the stasis recta, which is something that happens to a large percentage of people, women who have had children, physiotherapy has a lot of roles to play in that. And then you'll notice pelvic floor issues highlighted in blue. This is because it doesn't solely fall under women's health and wellness. Everyone who has a pelvic floor needs a pelvic floor physiotherapist. And in the Nigerian context, we don't have pelvic floor physiotherapists. In the US, there are pelvic floor physiotherapists, and they have internal pelvic floor physiotherapists who do some semi-invasive procedures also for assessment, diagnosis, and for treatment. And then there are the external pelvic floor physiotherapists. So children with persisting urinary leakages, women who have who have had babies and then they are having incontinence, urinary incontinence. Men also with BPH who are having urinary incontinence require the services of pelvic floor physiotherapists. So the next is community or community-based physiotherapy. Now there's a difference between community and community-based physiotherapy. Community-based physiotherapy is kind of like continuous service for patients who have been on inpatient care and so maybe perhaps live on the outskirts and then require long time to come to the hospital or may not be able to come to the hospital as required. So it's like continuing the inpatient services out when the patient is being discharged to the community. Going outside, checking their environment, checking their surroundings, checking their homes and seeing how they can function well in their homes. Now, that is where domiciliary services currently comes into play. That's community-based physiotherapy. And that is an aspect where I think National Hospital can key into because there are a lot of requests for domiciliary services these days. A lot of people would prefer someone goes to see them in the comfort of their home than they taking the pressure and the stress of coming over to the hospital at regular intervals. Now, community physiotherapy is an aspect of public health where it requires health education and promotion. Now, a lot of physiotherapists now are venturing into the public health arena. The current R4D director for Nigeria, that's Results for Development, which is an NGO that caters for health and education among specific countries, I think 18 countries. So the current director in Nigeria is a physiotherapist, all right? So it's physiotherapists, like my colleague has said, do a lot more than hospital services. Right? You can do health promotion and disease prevention because the root of a lot of the things that we see in the hospitals can be prevented at the community level. So why deal with them at the hospital when they can be prevented, right? So the next specialty, and the last, is sports physiotherapy. Now, contrary to popular belief, sports physiotherapy is not the same as orthopedics or musculoskeletal physiotherapy. It's a different domain on its own, and sports physiotherapists work with athletes of different age ranges to advise them on safe participation in sports to help prevent reoccurrence or occurrence of sports injuries and help manage those injuries for safe and early return to sports, and they also enhance performances of athletes. Now, I won't take much of your time, I'm going to finish now, but to bring everything home, I would like to say that, to reiterate, like kind of summarize, that physiotherapy, there are a lot of misconceptions around physiotherapy. And unfortunately, even amongst healthcare professionals, and that was why we chose this topic to present today. And when it comes to those misconceptions, there are those who want the easy way out, and then those who want the hard way out. Now, those who want the easy way out would usually say physiotherapy is about, massage. They're the ones who just walk into the department, just massage me. To put that, it's not that red light, just put it there and you feel better. Anybody who puts that red light on you without doing any prior assessment is a quack. But quote me anywhere, tell them I say that. Okay? So the ones who want the hard way out would endorse things like force movements. They'll say, here's your back. If you go there, you will cry, you will sweat. Is it not that one? And those are the same people, if you as a physiotherapist do not sweat or seem like you are doing sumo wrestling while you are attending to them, do not feel like they have achieve their aim of a session after they have come to physiotherapy. Now, I'd like to say therapy is a lot more than just massage and force movements. Of course, when there's a need for massage, we employ the use of massage. When there's a need for some forced movements, we employ the use of them. But it's a lot more than that. This therapy is about health promotion. We have a lot of roles to play in prevention aspects. Like I said, a lot of therapists are venturing into the public health arena, which is a lot to do with the prevention and eradication of major illnesses that are plaguing us. The therapy is also about patient education. We pride ourselves, like doctors have said, as being educators. We educate and we educate and we educate. Just imagine a single exercise procedure. One of the simplest you can think of can be difficult for different people to learn. So you have to review and teach every single time you meet with the patient. And then of course, when you are teaching them what to do for rehabilitation, you are also teaching them what to do to prevent reoccurrence. And then they go home and they educate their people. Okay, so my doctor says, I think my physio says, when you do this, this is what will happen. So try not to do this, right? So they kind of become ambassadors of healthcare in their own capacity. And finally, therapy is all about function. Because it's the forefront of what we do. We want to ensure that people function and do their preferred activities to the best of their ability. And in that regard, to cover everything up, I would like to advocate for early referrals to physiotherapy for patients who require physiotherapy. Because as much as, yes, you can do, it's never too late, I would say, for most cases, for you to be able to restore function. Sometimes it can reach a level where you could have done better. And we always want to give the patients the best that we can and to make them as independent as they can be for as long as they can be. So these are our references, and thank you for listening.